This is the meeting of the Governor's Lead Poisoning Prevention Commission. We appreciate you being here today. We will have a bit of a special treat at 10 o'clock. We will be joined by our new Secretary of the Environment, Serena McGowan, and we appreciate her taking the time in her busy process to become appointed through the Senate confirmation and to take on a new day. As we start, I just want to remind folks and to acknowledge that this is Black History Month. And as we think about that and the awareness on Black History Month, I want to thank all the efforts that everyone is making in the efforts to eradicate childhood lead poisoning that still, unfortunately, disproportionately impacts the lives of young African-American Marylanders. And this is the work we do together is an opportunity to create brilliant pathways ahead. And it takes every single one of us, from the amazing rental property owners who have done the work to carry forward the standards, to create safer housing, to our childcare and education and health professionals, and our environmental assessors and the whole ball of wax. But one of the things I also want to say is we start a new administration, that we have an opportunity to really replenish and lift this program and others. We have elected a governor who is deeply committed to the eradication of childhood lead poisoning and healthy housing. And I was pleased to see in his first act, while it was small, it was mighty. There was a $1.5 million supplement for the Maryland Lead Poisoning Prevention Program to help start to address issues of capacity. And hopefully there will be more as we look at coming out of the transition team, a commitment to raising both the capacity, training, and support for our state employees, including wages across all of the departments. I got a good look during that period of time, a very good and deep look at the Maryland Department of Housing and Community Development. We are soon to release and will release this afternoon our recommendations to Mayor Jake Day, which include efforts to increase lead poisoning prevention, eradication, and abatement at the Department of Housing and Community Development. And as soon as those are official, we will be sharing them with this commission. And I will be inviting today Secretary Day to join us. And then I will be inviting after that Secretary Laura Herrera Scott, who is a wonderful partner in environmental health and healthy housing, and is responsible for the first Medicaid managed care investment in healthy housing in the United States when she was at AmeriGroup. So I think we're heartened by these appointments. And if you can't at least feel excited and feel loved and feel lifted by the new governor when you hear him talk and you have an opportunity to meet him, we might want to talk about getting a pulse on that, because certainly spreading joy is one of his great things. So if I could, for the public, please, we'll do introductions of commissioners and get to the agenda. I'm Ruth Ann Norton. I'm the president and CEO of the Green and Healthy Homes Initiative, and honored to serve as the current chair of the commission. Can we start with Adam Skolnick and go to Paul Rogers, Anna, et cetera, and then identify, please.
Sure, Adam Skolnick. I'm the executive director of the Maryland Multi-Housing Association and a commission member.
Paul?
Paul, you're muted. Can you hear us?
Okay.
I don't know if we can.
There you go. Anna?
Hi, I'm Anna Davis, commission member.
Jack Daniels?
Sure. Jack Daniels, Director of Special Loans for the Maryland Department of Housing and Community Development, and commission member.
Mary Beth Haller?
Hi, everybody. I'm Mary Beth Haller. I'm a commission member. I'm serving the position of local government representative, but I'm also the deputy commissioner for youth wellness and community health at the Baltimore City Health Department.
Great. Barbara Moore?
Hi, I'm Barbara Moore. I'm a pediatric nurse practitioner and director for the lead poisoning program at Mount Washington Pediatric Hospital, commission member.
Benita Cooper?
Good morning, Commission Member, Maryland Insurance Administration.
Cliff Mitchell?
Cliff, you're muted. Cliff, can you hear us? You're muted.
And
There you go.
Master of Technology. Wait, not. Clifford Mitchell, Maryland Department of Health, Director of the Environmental Health Bureau, and Commission Member.
Fantastic. Thank you. Good morning, Jacob Benzequin?
Good morning, everyone. Jacob Benzequin with JVZ Management, and I'm a proud commission member.
Fantastic. Mangela Paul?
Good morning. I'm Angela Paul, a nurse consultant from the Office of Childcare at Maryland State Department of Education, commission member.
Okay. And Paul Rogers, do you have, are you able to hear us yet?
Yeah.
Yes.
Okay.
Good morning. Good morning. Neurodevelopmental pediatrician, representing Maryland chapter of American Academy of Pediatrics in the ECHO program.
Fantastic. Susan?
Good morning, everybody. Susan Kleinhammer, commission member, Lead Tech Services, and an accredited risk assessor. Thank you.
Fantastic. And Paula, remind me who's representing MDE.
That would be me.
There you go.
Good morning, everyone. My name is Paula Montgomery. I'm with Maryland Department of the Environment and the Land and Materials Administration. I oversee lead outreach and education and coordination.
Fantastic. And have I missed anyone, Wendy?
No, actually, you have everybody. Christina, I think, is the only one that is not here. Christina. No, I don't see her name.
Right. And so if you could put up the agenda, please, and we will first review the minutes of the last meeting, and if make sure that we have those. So if you want to put up on the screen.
It's coming.
Thank you. So have all the members of the commission been able to review the minutes of the last meeting? Were there any questions or amendations to the minutes? Hearing none, can I get a motion to approve the minutes?
Motion to approve.
Can I get a second? Thank you. All in favor?
Aye.
Aye.
Hi.
All opposed?
Aye.
Fantastic. No opposition. We've adopted the minutes. So we wanted to, you want to pull up the calendar, please, for the 2023 Lead Commission, please, Wendy, so we can review that. And if there's any questions, comments around that. And we've got 2 Cliff Mitchells, which is way too much of the world happening there, but, or way too good. Let me just say that. So we'll, so this month we are going to be reviewing some of these items around the legislation and various things from the department and from the city. But if you'll take a look, please, at the future months. And we have in March, I see a introduction and commitment of Governor Wes Moore. Wendy, do we have confirmation the governor will be joining us?
No, that was, I put that on from your last meeting. You said that you would like him to attend in March. So I put that on there as a reminder.
Yeah, there is an invitation. I don't know, in transition, I'm not sure if we've gotten that. And that is also the month we're asking the Secretary of Housing. So if you want to put those 2 invitations as out, that would be great. And anything on any of these months that people see that they would like to add or not? I would like to make a request that in May, we talk about the intersection of lead with healthy homes and the work being done on joint programs of lead and asthma as a part of Asthma Awareness Month. We will also in May do a recap of the Maryland legislature and any impact of budget or legislation. And also in March, we'll do a review of the state transition reports as it relates to MDE lead program. Okay. Just to get a sense of the committee, we are typically, by tradition of this commission, not operating in June, July, and August. And just want to, June is actually Healthy Homes Awareness Month and a number of things around environmental health. No, we're not operating. Last year, we did do a joint meeting with between commissions, something I'd like us to do again. But is there any thought about our June, July, and August dormancy or anything that anybody would like to comment on? Hearing none, any thoughts on the calendar for the year as presented?
So Ruth Ann, these meetings that you had mentioned in our last commission meeting still need to be scheduled. So we'll have to work offline to get those on the calendar if you still want that.
Yeah, I think we're most interested in, we had a water update, want to see when those monies are starting to become available to residents and residential buildings, certainly, and schools. And I think we need to kind of put a star on that. We need to, we will get on getting the MHIC, obviously. But Jack and Mary Beth especially, we are hoping to have sort of a dashboard of unit production on lead hazard control. I know, Mary Beth, this is not your department, and maybe Catherine's on. But for public transparency, we would like to be able, as this, have this commission have a way of tracking that. And Paula, remind me, do we have a section in our annual report that actually tracks the number of units abated or have undergoing lead hazard control by public grants in the annual report?
No, I would think that would fall under DHCD. I mean, we have the number of units that have met the risk reduction standard, you know, by third-party contractors inspecting them, but we don't know whether or not it was completed by federal funding.
Well, I want to post, I hope I'll get some engagement on this, but I think it would be very important for the Maryland Lead Poisoning Prevention annual report to the governor to include an aggregate look of cities, towns, jurisdictions, and agencies, whether they're state or otherwise, that have lead hazard control funding, and how the public is accessing that, and what number of units are made safer and lead safe, whether it's through the CHIP program, lead hazard control programs at the state, or by local jurisdiction. And I would really like to see that included in the annual report. And Jack saying he can do that. Does anyone else have a comment on that? Anyone anyone other for a moment than agencies who think it's a good idea, bad idea? could I hear from commissioners on that?
Paula has her hand up.
Paula, hang on one second. Is there anybody other than an agency first? Okay, I think it's a really important part of public transparency. Paula, go ahead.
The only thing I'm not too sure that that's not already reported, not in the annual childhood surveillance report, but I don't want to speak for Jack or Cliff, but I'm sure there is something that's reported. So
I think what I'm proposing, Paula, is that beyond it being a surveillance report, that there be a report of the commission and the activities around lead poisoning prevention and lead hazard control that is a little bit more robust, and that is more transparent to the public on the number of public dollars, whether they're federal, state, or local, being used for these efforts. And that we also can highlight really well the efforts of other agencies such as MDH, DHCD, and MDE in this report. So there's one comprehensive report so that whether you are a child advocate, an educator, a rental property owner, whomever, there's one kind of complete source. And right now we have 3 agencies that and city agencies that we don't bring that together, and I don't think tell that story. So I would really like to move for us to do that. Yes, Dr. Mitchell.
Just to echo, I think this would be a fabulous addition. I think we are all challenged to try to figure out not only where all the dollars are, but where all the activity is, in part so that we can figure out what populations and groups are being missed. And I think that's terrific. The one thing I would ask, and I think you would understand this, is each of the agencies has schedules of when we have to compile those data anyway. Frequently, it's the end of the fiscal year because we end up doing submitting reports either to Medicaid or elsewhere. So to avoid duplicative work for us, the one thing I would suggest is trying to figure out when we compile those data anyway, so that we don't end up having to repeat the wheel.
That's an important point. I have maybe an idea on how we might pull this together that is a living document, but let me hear from Camille, please.
I just want to be careful about how we tell the story, because the number is a small piece and it takes so much to get a family to the point that we can actually do the repair or the abatement of the house. So I guess or the dwelling, I just want to be really intentional about how we tell that story. Because if you just look at a number and you see that we did 2 houses in Allegheny County, that doesn't speak to all the work that went into what those 2 houses and what happened to those 2 houses. So I just wanted to put that.
Yeah, no, I get that. I think there's a number of things there, right? One, the mapping and distribution and to communities. One of the things that is really important is how do we track our dollar investments, the equity, how we're spending those dollars, how many dollars are sitting unspent, and what the public can actually help do and what other jurisdictions can help do to get those dollars out the door, to build the opportunity for contractors to see the opportunity and what we're doing. But I do think there's a way to pull this together. And, one of the things that I will certainly work with the commission and the agencies around this, but I was envisioning that this would be an amazingly good project, potentially for a public health school like the University of Maryland or the Morgan State Community Health School of Community Health or the public health to help participate in design or having graduate students to help staff putting this together. But I do think one thing, and just having gone through the transition work and listening in town halls about people being able to see, and I'll pick on Baltimore City for a minute, so Camille and Mary Beth and Catherine, forgive me, but if there's $19 million or whatever for lead hazard control work, not talking about case management of those things. How are we doing on spending it? Where is it being spent? If Jack's got money, I'll pick on Jack. I always pick on Jack because he's fun to pick on. But if there's money at the state that's supposed to be spent for this, how do we share that status report without somebody having to dig into page 700 of a report somewhere there? And I think if we're going to set a goal, a 5 to 10 year goal to eradicate lead, we have to share what those tools are. And it is something I think this commission could take leadership on public transparency, equity, and investment, and getting the story right. There's an awful lot of hard work to be done, and we know these are difficult issues, and we are trying to get sometimes to the most difficult structural houses in doing this work. But really important to talk about that, and to also share the really good things about the complete Maryland program. I saw an entire discussion on the internet on the LeadNet recently about how we test for kids going into schools and what we do in that. And Maryland just stood out as a leader, but we don't necessarily tell that story to our own citizens. And so I think there's an opportunity to just let people know the efforts that are being made collectively, and it will be a good guide for us. We have 3 websites or more to search on, but we have one mission and one set of work here, and I'm trying to find a way that we can pull a better public communication tool on this. Any other comments on that? Anyone willing to work with me and the department on that? Jacob, may I help hear from you?
Yeah, I mean, I don't have any immediate thoughts on it.
Are you volunteering to help?
I am, yeah, sure.
Thank you, sir. Great.
I'd be happy to.
Great. Love engagement. I would like to have, if we could, Cliff, yes.
Well, I will just say that we are, I think I'm delighted to participate as a contributor of data.
Okay.
So.
Me as well, Paula.
Great, thank you. And Paula, I'll work with MDE offline and see if it makes sense for us to get maybe some support from these schools of public health that have really good public health communications, right? Or environmental communications. But I think it's an idea that I just repeatedly heard through all the various inputs on my own experience, looking at transition reports. And we talk a lot about equity, we talk a lot about transparency, and we make it hard, not intentionally, for people to get data that makes them a better informed citizen and more supportive of things. But I can't tell you how many people I've heard from during this process who said they had no idea where to get access to these programs or how any jurisdiction is doing. And we don't want to just report when it's a problem. We want to report when good things are happening or when there's access, ability to give access in many different ways. So thank you for indulging me on at least putting that idea out, and I will try to call each of you and share ideas on what we can do to show leadership and engagement as a commission throughout the year for certain. Can we pull the agenda back up, please? So I do have made efforts to reach out to both Delegate Attar and Senator Carter, and I am awaiting having the opportunity to speak with both. Actually, Delegate Attar, I want to say, made herself available to meet with me, but I was in a legislative hearing and could not do that. So we are going to have a discussion with them on having representation from the legislature. But Wendy, did you want to bring up any other attendance issues with this?
So I did send this out because I didn't really know like exactly what you wanted in the attendance report. So I just put everything. So these are the numbers at the top here of how many people attended each month and basically who attended. The green is indicating that the person was there. So yeah, so everybody.
Yeah, and what you have here is also, I would like if you could, just to narrow this down for the commission members and share it with members, because I think we get very good attendance, and I want to thank people who make time. This is a volunteer effort, whether you're government or private sector, and really appreciate your time. But if we have some deficits that we need to pick up or anything like that, but also I think it's a credit to how well the members attend. But the other data is very important so we can see who we're reaching. So
yeah, so the commissioners that, we all have, it looks like we have really good attendance for the commissioners.
Very good. And I wanted to just highlight that. I think it's just been great, and we're going to try to get better feasible attendance from our legislative folks. From, I think Senator Carter is not listed on this. If you could add her in, and they have taxing schedules, but I think again this is good data to share and gives us an opportunity to see where we can share more. If you want to move to the next agenda item.
Well, I don't think the secretary's on yet. It's 2 minutes of 10.
Okay.
So when she gets on, we can just, I guess.
Absolutely.
Yeah.
So we have HB 79 was introduced, and Adam, I want to defer to you, and if you want to talk about this, or I'm happy to back you up. But HB 79 was introduced into the Maryland legislature the other day and does have impact on lead. Is Adam still on?
I don't see him on. He must have got kicked off.
Anna, do you want me to take this?
Yes, please.
Okay. So House Bill 79, introduced by Vaughn Stewart of Montgomery County, is actually looking to replicate the Pennsylvania whole house law that was passed last year. State of Pennsylvania put together a fund, admittedly out of American Rescue Plan dollars, so they were able, Jack, to be able to figure out how to put those dollars into housing for environmental health. They put $125 million into a fund under the American Rescue Plan to pilot a whole house approach, which will kind of dictate a process by which weatherization, lead, asthma reduction, trip and fall, and other aspects of environmental health, such as asbestos radon, are all looked at comprehensively and in a scope of work, and are funded as a single package to residents. Our organization that I represent, not on the commission, I didn't represent a position on the commission, but we did, along with the Maryland Association of Counties, the Natural Resources Defense Council, and a number of others stand in support of this bill. And one of the attributes of this is really twofold with relation to lead. One, we know from data that we can spend a lot of money on lead hazard control and asthma reduction, and families still move because of energy efficiency and weatherization issues, where the costs are too high or there's extreme heat and extreme cold. On the flip side of that, we know about 52% of the time across the state in various means, weatherization, according to the data shared with us by the department, weatherization often is deferred or declined because of mildew, moisture, lead, other issues. And third, national studies are starting to show that where you have a whole house approach, contractors are more likely to want to get in and do the issues of like lead would that often have marginal opportunities for profit or sustainability as a work product for them, that they're more likely to do this approach on the whole house. The testimony was very strong. I think the committee support was very strong. We were glad to see the Association of Counties in support of this as well. Happy to answer questions on this, but it is also being cross-filed. But I'm going to pause. It does look, Wendy, that we have the secretary.
Yeah, that is correct.
Well, it is, I don't see her yet on the screen. Is she up on our screen yet?
She is muted, so I believe as soon as she starts talking, we'll be able to see her on the screen because we have 37 people. Not everybody might be fitting on the screen, so.
Got it, understand. Secretary McGowan, when you are there. And
Hello, everyone. Can you hear me? I'm just testing the mic here.
Yes,
Absolutely. Secretary, it's Ruth Ann Norton.
You're right. I can't hear them. But we already have it turned up.
Can you hear us now? We can hear you.
I said something. We can hear you. Oh, they can hear us.
Yes, we
can't hear
can. Wendy, is there a telephone number that the secretary could also use?
There is, and let's see, I'm going to put the number in the chat. And then if she wants to call in.
She can stay on camera and then use the phone for audio.
So here's the phone if you want. I'm just going to type it in the chat.
Yeah. Thank you, everybody, for your patience. Adam, great haircut, man.
By the way, technology problems, right when you call on me, of course, I lose my internet, so my apologies.
No, that's okay. And just when we come back, if you have any comments on House Bill 79.
Well, you hit it all. I couldn't add anything to that, other than I guess my only question in
Hi,
terms of
everybody. I know you can hear me. Unfortunately, I cannot hear you. So the best I can do, and you're going to have to do this, is I wanted to jump on this call really quick just to introduce myself and to tell you how thrilled I am to learn about this commission. So far, can you hear me? And is it okay if I just tell you why I'm here? And then I have to run off because I have a hearing. Is it okay if I just do that? Okay. Perfect. I do see chat, so that works. Well, first, it's good to see all of you. I wish I could actually be in person just to say hello and shake hands. But this commission, from what I learned about the lead commission, I appreciate your mission, and we need you to help us do our job in terms of making sure that the children of Maryland are lead free, and that's the whole point of it. And so I'm just happy that we work together. As coming in as the new secretary, I'm here for you as well. I would love to be involved if you ever need me to be involved. And I wish we could have a quick dialogue. I'm missing that part, but I hope that you invite me again so we can talk about some of the great work that you all are doing. And you all know that MDE, we are responsible for lead paint, and pipe, and we have a lot of programs and we're doing a lot of things. But again, we're in it together. And so I'd love to hear more about this commission later on as time go on. All right.
Thank
you.
Ruth,
it's so good to see you, Ruth. I can't wait for us to get together again. And I see your note here, so thank you for that. I'm excited, really excited to be here. and to be transparent and to be a part of conversations, to be a part of solutions, and just be partners. That's how I lead. That's just who I am as a person. And I hope together we can do great things. And if that's okay, then I'm going to have to jump off right now. But thanks for allowing me to crash this meeting. It really was my honor. Okay. Bye now.
Thanks, everybody. I feel bad for the secretary. What I will say is I had an opportunity to meet the secretary on Inauguration Day. And she is really just bright and has a great articulation of how she wants to run the department, and comes to us, if folks do not know, comes to us from California, where she serves as the deputy to the California Environmental Protection Agency. She is coming to Maryland, where I was pleased to learn she also has a sister who lives here. So a little bit of coming home to family as well. So we're really delighted. We will invite her to come back. And if people would be interested, I will try to see if I can get the cognizant secretaries and maybe to come together to an in-person, at least, opportunity to meet them. And if you're interested in that, we'll work with you by email to see if we can pull everybody together and maybe see the three of them together. And Cliff Mitchell, congratulations, you got a great secretary at MDH, and Jack, I think you got a great secretary as well in Mayor Day from Salisbury. So can we go back? Adam, I think you said that. Any questions on HB 79?
Yeah, I think you hit everything. You hit the nail on the head. We're good.
Can I ask, do you know the property owner's position on HB 79?
We're for the most part supportive. I mean, we have some questions on funding, like I think you do and everybody else does, but beyond that, and correct me if I'm wrong, wasn't there a local match as well in the bill?
I think we're taking that out, or not me or whatever, but I think two things there's a number of amendments, and I will circulate those. And then, Wendy, I don't know how we could do potentially the process of whether the commission wants to support this. I do think it will help us better spend lead poisoning prevention dollars, just on a strict economic and efficiency analysis, and get more distribution. But one of the things, Adam, that from my GHHI hat, the delegate had in his bill a forgivable loan of 15 years. An owner had to own the property before it would become a rental property owners, before it would become a forgivable loan. He did shorten that to 5. He did I think a very good job of articulating in the hearing why rental property owners and homeowners should both be eligible for this fund. There was a question from Regina Boyce, a delegate from Baltimore, on that, and I think the committee came out seemingly satisfied on that. So this is an opportunity for whole house alignment to go to homeowners and rental property owners.
We gave him some similar input. We have some members, on the smaller side who gave him some input on income levels, et cetera, and ways to potentially make it work. So we're supportive, but we agreed that there were certain things in the bill that probably would functionally make not lots of rental property owners participate. And, so we were trying to suggest ways to get more participation. So, we agree. One of those things was dropping the number on the year, how long it takes to burn it off. So,
yep. So that has been dropped to 5. This bill is cross-filed in the Senate by Senator McKay. So we have a bipartisan support of this bill as well, which is a good reflection. And so Senator McKay, who I have to say I can't remember where he is from, maybe someone on the call knows, is supporting this on the Senate side. Any other questions on that? Because Wendy, Paula, what is the process by seeking support from the commission for this bill?
We just have to, if we have to do a vote on whether we support it and get a quorum. And then if everybody agrees in the quorum, if we have enough, then a letter would be drafted by the commission chair, signed by the commission chair, and then it would be submitted to the appropriate parties.
Okay. Well, I think we have enough time to circulate, Wendy, the bill with the amendments from the House, the fiscal note, and to take this up at the next meeting. So I'd like to take that up and ask people in the interim to review it. Would love to have, I know the departments haven't yet had a chance to take a position or not on this, as I understand. But I would just ask that we review this in the interim, and if we see an opportunity there. What is not on here, as we are just talking about these matters, is I know I'm kind of jumping on the legislation. We have this one up here, and we're kind of jumping the legislation. I do believe that there will be a proposal going to the Senate and House Appropriations, Budget and Appropriations Committees to increase funding and restore the community support for legal services, outreach, education. I discussed this with Secretary Tabata on our commission meeting prior. So there will be, I think, a push from the advocacy community to do that, and I will share that with the commission as soon as that is out. And I think something that seems like is likely going to come out of the transition report, and I don't want to advance that, is a recommendation for grants that related to lead and asthma and healthy housing, that loan language be pulled from the Department of Housing and Community Development for those things that are considered to be grants, and to pull the loan language out because it was determined that often, especially low-income homeowners and low-income homeowners in historically disinvested communities are very fearful of loans that, given the historical impact of predatory lending and older adults, especially wanting for age and place and different things, having concerns about having loan language on things that are intended to be grants. We think it's also better business on some things. We'll see if it comes out of the transition team or not, but I know it was strongly recommended from the members, and we'll I'll report back on that. Any other questions about legislative activities? Okay. Yes, Wes?
Rita, this is Wes. I just want to see, did you also want to discuss the budget bill and the 1.5 million lead fund that's recommended?
I did mention it, but what if you could review it for the commission quickly, please?
Okay. In the supplemental budget bill, which is HB 200 and SB 181, there is a 1.5 million in additional funding for the lead poisoning prevention fund at the Maryland Department of the Environment. So I wasn't sure if there was anything the commission would take action on that at all.
Yeah, and that's the action that I think from an advocacy community, we're going to ask that be substantially increased and make the case in the hearing to make sure that is substantially, potentially increased for lead.
Hey, Wes, it's Adam. Can you give me a call later today about 36, please?
Okay. Do you want to bring that to Ruthan's attention as well, those two bills?
Well, I mean, HB 30.
Yeah, go ahead.
HB 36 is a bill that requires landlords to have licenses if they're going to use failure to pay rent cases in rent court, which the Maryland Multi-Housing Association is in favor of, with some amendments, which we don't need to waste everybody's time on the amendments that we'd like. But whether the commission wants to get involved in that, we'll make sure we forward to Ruth Ann and to Wendy the amendments that we're suggesting, which we think are very reasonable. And then we can approach it with everybody.
Okay. And was there a second piece of legislation or just HB 36, Adam?
That was the only one I had.
Okay. So what members we will be circulating, and we will make public what we're circulating, will be HB 79, the proposed amendments for House Bill, I think you said 200, Wes, the supplemental appropriations bill, and HB 36 for review by commissioners. And then we will keep track of the pace of those bills in the legislature. And if we're able to do so, we will hold on the vote until the next commission meeting. If not, we'll figure out a way to vote with quorum by email. Barbara.
On the attachment, there was also House Bill 169.
Wes, do you know House Bill 169, or Adam?
That's the energy saving bill. Gold
Yes.
bill. That's the House version.
Sorry. Thank you, Barbara.
Okay.
So this is a bill that was passed last year by the Maryland legislature and was vetoed by Governor Hogan on the Saturday night of Memorial Weekend. So good to know people are working on Saturdays and Memorial Weekend, but it was vetoed. What this bill does is, here's the short skinny on this. The impact on lead is that it's like House Bill 79, calling for the alignment of dollars of weatherization, energy efficiency, lead dollars to work together in a more holistic approach for families, certainly better for their health and housing stability. But into the fund called Empower, which is a utility fund that then provides funding back to the public for energy efficiency and weatherization. The general non-low-income fund from utilities has about $130 million in it for the general public. That is fully spent out in many ways for the public. But on the investments for low-income communities actually contribute $48 to $49 million a year into the fund, but only receive back as a community $28 million a year, which sets up just a true inequity of expenditure and guidance. I'm happy I will share with the commission our testimony from the Green and Healthy Homes Initiative. But this bill would effectively right that inequity. The state has a 2% savings goal. We do not meet that in low-income communities, although we meet it in other areas. And so this is setting out guidance for the Department of Housing and Community Development about priority expenditure to the lowest income communities and housing stock of greatest need. Wes, would you like to say more about that?
No, you covered it.
Okay. It has, we think, similar implications as the whole house in being able to provide more effective and efficient ways of getting to our hardest housing stock and lifting the condition of this housing stock from an energy equity lens, but it also does address the toxins of lead in this work. It will also establish a task force that will look at an align, grade, coordinate process. And this bill was just recently written about in the Maryland Matters newspaper. If you want to read about it, they did a great job on it. And we will share that with the commission. But we had a really quite strong hearing. The bill sponsor in the House is Laura Charkoudian from Montgomery County. The bill sponsor in the Senate is the chair of the Education, Environment, and Energy, or in some order there, committee, Brian Feldman, and we had the Senate hearing the other day. So we'll see, likely to get passed again by the legislature, and we will see if the governor approves or not of that bill, given the past veto. All right. Again, we'll circulate that. I think if people are inclined to support, we will, but we will circulate all of this in a memo to the commission. All right, Cliff, you are up.
So, good morning, everybody. It's a delight to be here with you, and I have a couple of things. I believe the main thing is to share with you our pages on lead and website. And before we do that, I do have one brief announcement, which is, as you recall, this is a follow-up to the presentation on the lead evaluation report. That report has just been released and posted to the website. And I can actually put the location into the chat. So that is our literally just released evaluation of childhood blood lead testing. So thank you for all of the feedback during the presentation, which we incorporated, and so we are really, really pleased. I'm really, really pleased that we finally got this out. And this, you'll find, includes the recommendations I discussed with the commission related to maintaining for the current time our universal testing of all children at ages 1 and 2, and consideration of all areas in the state as potentially at risk, plus a number of other recommendations. So with that unsolicited advertisement, now let me just show you what we've been working on. I want to preface this by just saying this is a project we are doing jointly with Maryland Department of the Environment. I don't know if Fred Banks is on, but oh, there's Fred.
He is on, Cliff. He is on.
Thank you. But I really want to acknowledge the support of the Childhood Lead Registry. They are providing us updated data, and I will show you what that all is in a minute. Let me just give you a picture of what we have been working on. This is our portal for the tracking page. As you know, and I've presented this to the commission in previous years, before some of you were members, perhaps. Maybe I can make it bigger instead of smaller. That just would be novel. There we one less. How's that? So this is just an overview. I'll give you the citation for this in a minute. The website is actually right here. And this, if you want to follow along in your readers or browsers, that's the website where this page is located. And the whole goal of environmental public health tracking is to make environmental health data publicly available for action. So the theme that you'll see across all of our tracking pages is we provide an overview of the data, and that is our sort of description, which is not too long, but I hope just long enough. Metadata for people who want to know about the metadata, and you probably all know who you are on this call. And then really it's to talk about data moving to action. That is the whole point of the tracking portal and its structure. You'll hear, I think, about the Maryland EJ tool, and I think of these as complementary tools in thinking about how we look at data and use data to make decisions. So there are 4 tabs that sort of run thematically across all of our topic areas. And the topic areas you can see here include asthma, carbon monoxide, childhood lead poisoning, chronic obstructive pulmonary disease, heart attacks, climate change, drinking water. So we cover a lot of environmental health data. We're going to be adding cancer and different types of cancer, as well as a number of other topics in the near future. But childhood lead poisoning, obviously, what we start off with is, what is the picture of childhood lead poisoning in the state today? And this is an interactive map where you can zoom in on various areas. We show you elevated blood lead rates by county. MDE is in the process right now of putting together a data package for us that will allow us to show these data at the census tract level. So as soon as they give us those data, we will be making available census tract level data across the entire state for blood lead level rates. And so here you can see this is the percentage of children under the age of 6 with blood levels greater than 5 micrograms per deciliter as of 2019. We'll be updating these when new data become available. They are not available yet. As Fred can tell you, the registry is currently in the process of adding its 2021 data. So all of the data that we'll be loading will be 2010 through 2020. That will all be where we'll show elevated blood leads at the 5 micrograms per deciliter and greater. When we get to the 2022 data eventually and the 2023 data, we will show those at the 3.5 micrograms per deciliter level. But we show rates, we show counts. One of the reasons for showing counts is this actually shows the burden in each jurisdiction and shows you the number of children. So it's not just about the rates, it's also about how many children are affected. And then we have trends over time. And you can look at this by state or by individual jurisdiction to see what's happened in each of the jurisdictions in the state. So that's a little bit about the sort of basic epidemiology of lead. We move from that to talk about what are the drivers that make this what it is. So think about it this way. We're showing you this is the problem, and then we're moving to why is this problem here and what are the drivers of that problem. So this is a page which shows you about elevated child blood lead at housing age. And we also have an indicator for poverty. These are taken from the American Community Survey. And the goal here is to help people understand why are these data the way they are. So if you click on this map, it will show you, for example, the percentage of children under age 6 with blood lead levels in Allegheny County, and then the percentage of housing built before 1980. Now, we can't do the 1987 or 1978 data because the American Community Survey doesn't give us a time block for those. But this is an approximate way of explaining to people why the programs are there that are there to address this problem, and why are they structured the way they are. And so I am in the process of, as I said, updating these data with 2010 through 2020 data, and I hope to have those up sometime in the next several months, as soon as MDE can get us the data. The final thing I'll say is, what are we doing about this? And here, this is where the discussion about those sort of cumulative programs becomes important. So the programs that are directly under the Department of Health are primarily related to childhood blood lead testing. So here we show you a little bit about what testing rates are across the state. This is a way of our engaging with healthcare providers and parents about the importance of testing. Trends in blood lead testing, again, across the state and by jurisdiction. And then mean blood lead levels as a way of showing what's happening in each of these jurisdictions. And we provide you with not only the jurisdiction, but the state as a means of comparison. We also have a section here on more data where you can actually download the complete data set so that for people who are interested in using these data, we make these available for download. Adam?
Do you have the breakout by source?
So we don't have the breakout by source. Part of that is a limitation of how often those data are available. Remember that MDE started categorizing by source only in some of the more recent annual reports, and we don't have line level data that shows that. But one of the things that we are interested in doing is providing linkage here for parents and others, so that they can link to the annual reports where there is a discussion of source materials. Eventually, this will be more integrated so that it'll be not exactly a one-stop shop, because we don't want to duplicate work that MDE is already doing, but we are going to make it easier to find those data. So that's a terrific question, and we will incorporate that in, or at least a reference to source discussions as part of the discussion in the discussion part of this website.
Thank you.
So that's just a quick overview for the commission. As I said, I am very anxious to load up the data at the census tract level, because I think it becomes much more meaningful when you start looking at, we can't do neighborhood level data because for privacy purposes, we can't have data with numbers that are so small that you could potentially figure out who a person is. But at the census tract level, we are able to display those data and have those be meaningful, and you'll be able to look at those over time.
This is really well done. So when is it getting published and sent around?
Oh, so it's available and open now. If you go to that website, it is there and running.
Are you doing any kind of push out of this?
Well, the tracking program, we've had a website up since 2008. This new version of the site has only been around for about a year or so. We launched in about fall of 22. Something else was happening around that time that made it really difficult to break through the news cycle. I think it was called COVID.
If it's okay with you, and I can reach out to Candace or whomever would be appropriate, I know in our upcoming newsletter, we'd love to cover this. That goes out to about 10,000 people around the country.
Absolutely.
We would love to do a spotlight on this. And so I'll have our communications person reach out to you all.
Yep.
Okay.
Yep. So yes, so I would welcome that, and I think really what we are trying to do, and I think MDE feels the same way from every conversation I've ever had with MDE, which is we definitely want to make our data more available so people can take action. So that's really the goal here. And I know that Paula shares that, and Devin and all the folks at MDE, and that's been pretty consistent through all the administrations. So I know that we'll be working very, very closely with MDE. As I said, we don't want to, for efficiency purposes, we don't want to duplicate what is happening at MDE, but we want to complement it And we do believe that for planning purposes, using these data and making them available at a scale where people can set priorities based on actual data is helping everybody.
That's amazing. Any other, and thank you, Cliff. This is great. Any other questions or comments for Cliff? All right, rock stars.
Yeah, I have a quick
Angela.
question.
Okay. Mangela first, then Jacob.
Thank you, Dr. Cliff. Love the chart. The data also, I'm just looking at the percentage of the children tested for each county. It's really beautiful. And I know that it is the pre-COVID data, and the highest percentage number of children for tested is 32% for Montgomery County. So if you're looking at the post-COVID, it's going to be really low comparing to 2019 data. But now it's visual and everyone could see it, public could see it. It's kind of indirect force to them to see why this rest of the children are not tested, what those barriers are.
So you'll be pleased to know, Mangela, and I'm going to give Dr. Rogers, as always, all the credit for this. But we actually just did yesterday as part of his Project Echo that he's talked about, we did a CME event for pediatricians specifically focused on testing rates. And we are in the process of working with MDE and the Childhood-Led Registry again on putting together essentially a report for providers. We got very useful input from the group yesterday, but a lot of this, I think, is about outreach to the providers directly to give them an idea of the importance of testing, the importance of follow-up testing for children with a level of 3.5 to 5, and how it is that by doing that, they can actually prevent lead poisoning by preventing ongoing exposure.
Love the parent information also, the flyers that are attached. I'm going to download and distribute to
Fantastic, Mangela.
Thank you.
Jacob, you want to go ahead?
Yeah. Hi, Cliff.
Thank you.
Thanks so much for that presentation. I'm curious about how does a presentation like this translate to your average citizen, particularly on the low income side, where some of this stuff, and again, I'm just trying to the best of my ability, and as a property manager who does work with a lot of subsidized housing and low income folk, they get overwhelmed with a lot of data and with a lot of information. How do we effectively use this to be able to, I guess, just communicate in a way that's effective, and so that they can, I think that, to me, it's like, oh, there's a lot of stuff going on, I better just get tested, as opposed to, hey, there's resources, tools, et cetera, it is important. Let's see what we can do to make sure that you get tested. And I guess I'm just wondering, how do you manage both of those things, meaning keeping the data the way it's supposed to be and not sanitizing it, but at the same time, sending that message over to people in a way that can be heard, and like you said, it can lead to action.
So, Jacob, I love that question, and it is what I have struggled with all along with this project: is how does this meaningful to the average user? And so, a couple of things. One is we've tried very much to provide text beside this that is really reading level appropriate, not too complicated, relatively simple, with a lot of links, so that people can look at this, and they not only see the data, but they actually see some stuff that they can read about it that can help make it meaningful. I totally share your concern about the sort of data overload part of this. I think it is something that we all struggle with in this arena, which is we want people to be able to use the data, but the more data that gets presented to people, the more overwhelming it becomes. And So as an example of that, you know, one of the things, and Angela, I didn't point out, but I will with this, if you zoom in to one of these geographies, you can actually turn on a layer that is all of the schools in the area. And we've incorporated that in part because, Jacob, to your point, I don't expect that everybody will be able to use everything on this, but we want to tell the story in a way that if you are interested, you'll find guidance to the answers. So let me give you an example of how we might do that in the future. We have a map that isn't yet up, but it's about lung cancer, radon, and smoking. And we're literally going to, I think, try to show in some ways the relationship between lung cancer rates, radon levels, and tobacco. And the goal isn't, the goal really is to get people to think about those big drivers of getting your home tested and thinking about smoking cessation. And for any individual, each of them is going to come to this with a different set of expectations, a different set of knowledge. If we can at least prompt people to think about the relationship, they can then go on to ask more in-depth questions and contact us. So I realize that's not an easy answer, but what we're trying to do is sort of provide a way for people to think about that complicated relationship between environment and health, and come to us and come to their local planners and others to think about how do we improve the environmental health of this community.
Can I make just one suggestion, perhaps?
Sure.
And I'll be happy to talk outside of this.
Yeah.
I know that there's a lot of interaction that happens with the different schools, different local schools that have obviously health departments. I'm talking about universities and college kids who are aiming to work in this field. I think videos, in particular TikToks, and again, yep. I'm not a TikTok guy, so yep. I don't want anyone to jump on me here.
Yep.
I'm too old for that. But short videos, and I would say, why don't we engage some of the universities and say, hey, how would you guys present this information in a way that would be palatable to your average citizen, and start incorporating that into some of the information that's being shared here. I think that would be fantastic in a way to really help it, bring it to the practical, show videos of like, hey, you might not know this, but in your house, this and this is happening. Make a short TikTok and hey, call us, talk to your local, health department, et cetera, et cetera. It's just a thought. Obviously, happy to kind of churn it out a little bit more with you.
Jacob, I've already written your name down. You're going to be getting a call or a tweet or an Instagram post or a Reddit thing, which I don't know what it is, from me. And I don't know how to do that with the emojis. Just
so I'm for both of you, I'll offer that we just hired a digital and social media specialist. If GHHI can help support those efforts, please reach out to Beth Bingham or Sade, and give it till later February, because our social media digital person is newer and she's getting onboarded, but comes from the National Coalition or National Council on Reinvestment, so offering to help as a public partner there. Hey, Paula, and then I think we're going to move on to the next agenda item for time.
Thank you. I know as part of the House Bill 1110 study, MDE will be continuing to work on some shorts regarding case management, accreditation, and those at sources, but we would welcome any help with.
Happy to do it, Paula.
Yeah, we would welcome any help with, and I'd be more than happy to share with you guys what some of our ideas are, and they would be shorts and they would be posted on social media, because I do agree with Jacob about getting the message out. No one wants to read anymore. We just want to be told, or in a video is very appropriate to get the message out. Thank you.
I don't subscribe to the nobody reads philosophy, just personally, but I will say happy to do it and happy to work on it.
Great, Cliff, as always, thank you. Do we have the environmental justice presenter here? Caitlin, are you on?
I'm here.
Fantastic. We're so glad to have you this morning. And if you could give us a brief around the department and what you're doing, and your how it may be intersecting or should be intersecting with our efforts, we would be so great to hear that. And are you a new employee of MDE, or?
Sure. So can you guys see my screen that I'm sharing?
Indeed.
Okay. So my name is Caitlin Eversmeyer, and I've been at MDE for about 8 months now. And I am the Environmental Justice Communications Administrator. So I work directly with Devin Dotson, and he's testifying today. So I'm here representing MDE and all things EJ.
Great. Thank you.
I'm going to go through a short PowerPoint presentation about our internal environmental justice policy, some legislation. It's about 7 minutes, and then I'll go through a demo of the tool and show you how to run a screening report and let you guys ask any questions as I go along. So the EPA defines environmental justice as the fair treatment and meaningful involvement of all people regardless of race, color, national origin, or income with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. Fair treatment means that no group of people, including racial, ethnic, or socioeconomic groups, should bear a disproportionate share of the negative environmental consequences resulting from industrial, municipal, and commercial operations of the execution of federal, state, local, and tribal programs and policies. So in the state of Maryland, we built upon this definition from the EPA to include that citizens should be able to expect that they have public health protections and have access to resources to use to address these health concerns. In 2020, MDE created our first environmental justice implementation policy plan, which was signed by former Secretary Ben Grumbles. And I updated this policy in 2022, at the end of 2022, and it was signed by former Secretary Horatio Tablata. This policy is a living document, which is being continuously updated by me and other staff. This policy originally created the Environmental Justice Officer, who serves as a liaison between Maryland communities and the department, and it also works with our administration's land, air, water to incorporate environmental legislation and policies. And Devin is our Environmental Justice Officer. Our policy also created a full environmental justice work group and multiple sub-work groups to execute all of our policies and objectives that we outlined in this policy. One of the sub-working groups that we created was a mapping and GIS sub-work group, and they developed the MDE environmental justice screening tool, which I'll demo. The Commission on Environmental Justice and Sustainable Communities reviews laws and policies to address environmental justice and sustainability concerns, and the Commission writes an annual report which includes recommendations to the Governor and General Assembly. And we just released 2022, so you can go online and read that as well. Some information on some important legislation. The Climate Solutions Now Act of 2022 required MDE to discuss methods for identifying communities who are impacted by climate change with the Commission on Environmental Justice and Sustainable Communities. And this bill actually defined an underserved community. And that means any census tract in which, according to the most recent U.S. Census Bureau survey, at least 25% of the residents qualify as low income, or at least 50% of the residents identify as non-white, or at least 15% of the residents have limited English proficiency. It also defined the definition for an overburdened community, and that's any census tract in which 3 or more of the following environmental health indicators are above the 75th percentile. And so there's 21, and this includes, for example, exposure to lead paint, proximity to hazardous waste landfills, proximity to traffic. House Bill 1200 requires applicants whose permits require a public notice to submit an environmental justice score in their application to MDE. And they are required to utilize any type of Maryland screening tool. Now, MDE is also required to review the environmental justice score. We're going to confirm that it's correct, and then we include that information in the public notice. MDE is currently taking it one step further, and we're going to run our own internal screening report, and we're going to include a 1-mile radius around the proposed site to give us more of a full picture of what other facilities are in the area, what is the census tract data telling us. And this bill defined an environmental justice score as an overall evaluation of the area's environment and existing environmental justice indicators, as defined by the department in regulation, including pollution burden exposure, pollution burden environmental effects, sensitive populations, and socioeconomic factors. And this came into effect on October 1st, and we are currently writing regulations for this bill. Some other relevant information: Senate Bill 90 required MDE to create and maintain a database for supplemental environmental projects, and House Bill 53 required the Commission on Environmental Justice and Sustainable Communities to make recommendations to MDE on how we can improve access to safe, clean, and affordable and accessible drinking water. This is our this is MDE's environmental justice screening tool. We launched the beta version this past summer, and we accepted public comments. After we incorporated public's feedback, we released version 1, which is what I'll be demoing for you today. And we're still asking for public feedback. So if you use this after this presentation, if you share it with staff and you see that, if you have any comments, please feel free to email me or Devin, and we can look more into that. In the next month or two, we are going to be releasing version 2, and that will include new data as well as updated 2020 census tract data. And this screening tool is unique because it incorporates demographic and socioeconomic data, which we used to define an underserved community. But additionally, MDE has access to permit information, which is incorporated into this tool, which you'll see. And so, for example, if you type in your address, you can look up if there's facilities in your area. For example, if you're close to any dams, wastewater treatment plants, high air emission facilities, etc. MDE is using this tool currently to enhance compliance, monitoring, and community outreach. And this is our contact information. So if you have any questions after this presentation, feel free to reach out to me. Any questions before I move on to demoing the screening tool?
No, that's great. And do that. I just want to let the commission know that I have to step off to talk to members of the legislature at 11, and Adam Skolnick has so kindly agreed to take the chair position. So I want to thank everybody today. The one thing I would say, Caitlin, before I get off the call, it does dawn on me that there is now money going into the Maryland Clean Energy Center and Green Bank, and some of the uses of that money allow for use on toxins like lead paint. And we will invite them to present as they're going to be actually loaded with a number of different initiatives under Climate Solutions now. And when we do, I hope you'll come back and at least be part of the audience and discussion on that. I want to thank you for your presentation today. Adam, thank you for your partnership, and thanks to the commission. And Wendy, we can touch base quickly after the meeting. Thank you.
Clearly, the commission is stepping backwards if I'm going to chair it. Go ahead, Caitlin.
All right, so this is MDE's website, and I wanted to highlight how you can access our screening tool. It does pop up on our carousel, but I just recently added to our website an environmental justice tab at the top. And I'm building out this website, so it's still very basic, but I'm trying to work to add more information. On the left-hand side, you'll have the screening tool, and this gives you some more information about our screening tool. I downloaded maps for the 2019 data, so if people don't have the ability to utilize the screening tool, if it's too complicated, they can at least still access some of the information in these downloadable maps. And then you can launch the screening tool right at the top. And let me put this in the chat, a link in the chat, so if you have any questions. So this is our screening tool. This is what automatically populates when you first open the tool. And if you see on the left, this is our legend, and it automatically populates this layer, which is the environmental justice it's the overall score. And right now our overall score specifically is for underserved communities. So remember that definition talking about poverty, minority, and limited English proficiency. And you can see that the darker the blue, the greater that they align with a community, an underserved community. So you can see that the surrounding area of Washington, D.C., Baltimore City, and a little bit on the Eastern Shore, like where Salisbury is where that overall score is. Now you can also go down and highlight these specific indicators. So you can look at a layer that's only minority. And it's again kind of similar to the overall census data. It's again in PG County around Washington, D.C., in Baltimore and around Baltimore City, and again by Salisbury. If you look at poverty, it's a little bit different. It's still PG County, Washington, D.C. area, Baltimore, but you're also now looking at a lot of Western Maryland and Eastern Shore. And finally, our limited English proficiency. Again, it's kind of like Northern Washington, Baltimore, and along the Delaware border. And as I mentioned earlier, we're currently working on the new version of version 2, which will incorporate more information specifically. So we have this definition of underserved. We're now incorporating more data to touch on that definition of overburdened, those 21 factors that are indicators that I mentioned earlier. So we have some of the EPA's data in here already if you want to look at it, but again, it'll be updated specifically to Maryland. One thing I can highlight is we do have the EPA's lead paint indicator layer, so you can turn that on. And you can see As you guys are aware, it's going to highlight areas around Washington, D.C., PG County, and around Baltimore City. Some other things to note on this legend, we have MDE data, so you can look at proximity to dams. You can see where they're all located in Maryland. You can look at wastewater discharge facilities. If you click on these icons, it'll pull up a pop-up window and it will give you more information. Different things like solid waste facilities. And something I want to mention is that you can add your own data. So for example, if you guys have a shape file, some type of Excel file, you can add your own data to this chart or mapping tool. And then you can also add any type of Esri available data. If you search it, you can add it in. Along this top right corner, we have additional MDE data. I don't know how relevant it would be to specifically lead paint poisoning, but we have, for example, like dam safety, TMDL, fish advisories, consumption advisories, beach advisories. So I'm going to go through a screening report with you guys really quick. The first thing that I recommend if you do a screening report is you go onto this layers and you turn on all layers. So this will give you a really good overview of everything that's happening where you're going to be searching. You're then going to click on this button, which is the MDE screening report. And it might take a second to load. And it's going to give you the option on how you want to search an area. You can type in a specific address. If, for example, if you're looking at a school area or a county, you can actually draw a box, or you can use a free mouse and draw around the area. Yeah, it's really taking a long time to load. This is abnormal. You can type in coordinates. So there's a variety of different ways that you can search. I guess let me turn off the EPA data. Maybe that's slowing it down. There we go. So now that you have all the layers turned on, I'm just going to use an example of like looking up where the Orioles stadium is. So I'll type in that address. And it'll pop up. You can hit zoom to. And if you click on the actual census tract, you click on the individual census tracts and it'll pull up this pop-up window and it'll give you the more information. So for example, this census tract is 99% minority, 89% poverty, and 0% limited English proficiency, which gives you an overall environmental justice score of 99.86%. Right here is Camden Yards. So again, it pulls up that data. So you don't have to actually run a screening report if you're just looking for the census tract data. But again, you can do it however you want. As I mentioned earlier, MDE is doing a 1 mile radius. So you can type in whatever parameters you want and you can do 1 mile. And so it'll automatically populate this radius around. And it will pull all the information into that one census, one screening report. So it's not just going to only pull that census tract data for where you're looking at. It's also going to pull the surrounding census tracts. And then I'm going to turn that off because it'll run really slow. You'll then hit report. And you can hit print. You can also download the data. You select print. And it's going to take you to a new tab. And it's going to auto-populate the map at the top. So if you zoom out further on Maryland, it's going to populate that. If you zoom in, that's what it's going to show. and there wasn't any active high air emissions in that census tract, any dams, any type of that, any layers that were in those census tracts would populate here. So this gives you an idea of the census tract of where Camden Yards is related to. And at the bottom, this gives you that overall EJ score, which again is only for underserved communities, that socioeconomic score. And of course, it's taking a long time on this work laptop, but if you run a screen report, it'll show the map and it'll include the legend, so you can make sure if you're showing this to someone else, it'll show that information. And if you have any other questions, we have a how-to button at the top. And so it'll take you to a new web page. It'll give you more information about the department and about how to actually use the screening tool, because there's a lot of other information that I'm not covering. All right, so it populated the maps. This is what it looks like. So does anyone have any questions?
All right, thank you very much. Anybody have any questions for Kaylin? Camille, what do you got?
I actually don't have any questions. I just want to say thank you to Caitlin and Devin and Lisa. As the chair of the Commission on Environmental Justice and Sustainable Communities, this was a huge, heavy lift, and it's incredibly helpful. So I just wanted to do a shout out.
Shout outs are good, but Camille, you got to go back on camera because you're next up on the agenda.
I saw that. So my presentation is not long. I'll ask Wendy to share while I talk, because I can't do two things at the same time. At the last meeting, there was a conversation or questions about violation notices, and this is strictly in Baltimore City. So I have about 10 slides, shouldn't take too long, and then I'll ask questions. I also wanted to acknowledge Lori DeLester, who is the program compliance officer, who actually issues the violation notices. So she's sitting out there or sitting out in the hallway for me, but there also, if I need to ask questions or if I say something that is stupid or either is incorrect. So just quickly,
Camille, I'm sorry to interrupt, but I just want to make sure, can you define property owner for everybody? Because that's kind of an important one.
Okay, we didn't do that, but I will do that. I mean, outside, so a property owner can be a host of things. I mean, you know, man, woman, child. It actually is someone who legally owns the property, and that gets a little blurred depending on who's listed on the deed, and we do that research. It could be several people, it could be one people, it could be a corporation. It doesn't have to be a person, if that's what you mean, Adam. I just wanted to.
That's what I would just want to make sure everybody knew. That's all.
Yeah, it doesn't have to be a physical live person. It could very well could be a corporation as well. So a lead violation notice is it's a legal document issued to the property owner and or entity of an identified property by the Baltimore City Health Department Childhood Lead Poisoning Prevention Program. This is what the notice includes. It's a notice number, the property address, the inspector's contact information, and the issuance and compliance dates, which are the date the violation notice is issued. And then we'd like you to comply with 30 calendar days from the issuance date, but there's some room in that as well. So we'll talk about that a little later. You can hit the next slide, Wendy. The next two slides are actually copies of what the actual violation notice looks like if you've never seen one. And that's why Wendy sent the PowerPoint out to you all ahead of time, and we can certainly answer questions, but I didn't know if everyone had seen one, so I wanted to make sure you saw what that looks like. You can go to the next slide. Thank you, Wendy. So what action triggers a violation notice, which is the next slide? There are several things. We receive a lab report from a medical provider that has a blood, and the child has a blood level equal to or greater than 5 milligrams per deciliter, and it prompts an investigation. Sometimes MDE will reach out because they've gotten a notice of defect from a citizen, or a citizen sometimes will call MDE directly and they'll refer it right back to us. So we'll get out there. Usually within 2 to 5 days, we schedule an inspection with the tenant and or the property owner. It doesn't have to always be the property owner. We can schedule it with the tenant. Now, there are cases where if their blood lead level is really high, between 30 and 70, and it actually is usually a 20, we're out there within 24 to 48 hours. The inspection is an inspection by an environmental, sanitarian, or inspector, because we use those terms interchangeably. And they conduct the inspection by use of an XRF analyzer, which we tried to give you a picture of. We test soil and dust wipe samples. And there are other tests we do, but those investigations are more prompted by conversations with the tenant. And we can talk about that. Important info. Only a sanitarian or inspector who has received special police powers from the Baltimore City Police Department can issue a violation notice. And there is a process that we have to go through here. If the XRF report shows positive readings equal to or greater than 0.7 milligrams per centimeters, good Lord, and or lead dust equal to greater than 10 milligrams or 2, okay, you all can read that. Window walls, because this is so technical for me. Valerie, who is actually not only our supervisor, but our only sanitarian at this point, will come back and actually have a conversation with Lori and issue an actual violation notice. We actually check all the ownership and entity information through real property data, which is SDAT, and then the violation notice is issued to everyone who has ownership or everything in the property. Next slide. What happens next? The violation notice is sent to the property owner of the property by certified mail via USPS. Unfortunately, the U.S. Postal Service is what we have, and it's what we use. And or we go out and post it to the door of the property in a sealed envelope as well. The violation notice is then added to the active list of violations on our website, and we gave you all our website as well. A lien is placed on the property in the land property system, and the owner is given 30 days from the date of issuance to abate the property when you contact them or contact the environmental inspector listed on the violation notice. There's some outliers and some things that happen. Sometimes the property owner may need a couple extra days or may need 10 days. We recognize that life happens, so they actually can write in and ask for an extension. We review the case, we review the property owner's history if they have one, and sometimes more than likely, not sometimes, we actually grant an extension. We have a conversation with legal and the extension is done in writing. If the property is owned by the city of Baltimore, or they're a part, or HABC, or they're a part of what's formerly known as Section 8, which is a housing choice voucher program, or it's located within public housing, we either DHCD or HABC are notified of the violation, and we do our best to push that they assist with compliance, and they do fairly well and fairly quickly as well. The rules still apply, but we reach out because they're a city partner. The property owner must have the property abated by a licensed lead abatement contractor, S2, S4, and those are listed on MDE's website. It's the responsibility of the property owner operator to schedule a reinspection, contacting the inspector listed on the violation. It's also, as you all well know, the property owner's responsibility to relocate the tenants as well, and we listed where that is in COMAR. Next slide. On the rare occasion that someone doesn't comply we actually share an attorney with Baltimore City DHCD. We found that that is probably one of the most effective ways to use our attorney, because he also has access to all of the, if there are any outstanding housing code violations as well. So we try to kind of get it all at one time. If the property owner is non-compliant, the DHCD attorney can proceed with legal actions, but we exhaust all other remedies. It is a last resort. I can't say that enough. I will go to court. We will go to court, but it is a last resort. We give property owners every possible chance to figure out what the next steps is, especially if there are grants or money's available. We do our best. A violation and lien remain on the property for the life of the property or until it's deemed or abated by the inspector. If the property gets sold and has an active violation, the new owner inherits the violation. We get those calls, the I didn't know calls all the time, prompting a violation issued in the new owner's name. Next slide. Reinspection. We go out, we set up a meeting, and we reinspect the property. If the visual inspection fails, we advise the property owner and or the contractor quickly what needs to be, and it's on site, what needs to be corrected, prompting another reinspection. If the dust wipes and visual pass, an abatement card is mailed to the owner. Next. And I actually sent you all have a copy of the abatement card, and I apologize. It's not the best to see, but once it's passed, the violation is removed from the active violations list, the lien is removed, and the case is closed. However, if the child is retested after the abatement is completed and the blood level has increased, the case may be reopened, and sometimes that happens. The abatement card, as I said, is mailed once all the paperwork has been completed by the sanitarian and also the compliance officer. Also wanted to let you all know who the staff was and answer any questions.
Any questions for Camille?
And you can always email me after the fact.
Well, we're gonna skip around a teeny tiny bit and go to agency hot topics because we already have Camille and or Mary Beth. Do you guys have anything to add?
None whatsoever.
Awesome. Jack, lead grant programs.
All right, due to sensitivity to time, I will just give a basic overview of where we're at. We actually just had to submit our numbers for the fiscal year up until the end of December. So obviously, we're most concentrated here on lead for the commission, but my overview is many other programs, including part of the legislative bill for whole home repairs. We do many of those repairs already. Just trying to find an avenue in that legislation to be able to do it a little bit more easier with a little bit more leveraging. There's a lot more to that. Not trying to simplify it, but anyway, currently right now we're starting to cook with fire a little bit with Baltimore City DHCD and the MOU that we are using with them. We have 20 deals that we have funded for roughly 150 or about $151,000. We're getting about 2 submissions a week coming over. We're getting prioritizing those with our underwriting staff to validate, to verify, so that we can move those forward as quickly as possible. We have committed 5 of our Healthy Homes for Healthy Kids projects for a little under $500,000. We have a pipeline of 12 deals that are in either some sort of stages to get back to us for committee approval. One of those 5, we just received committee approval either yesterday or the day before, and we're working on the accommodation piece of it. The contractor needs the family completely removed. It's not a situation where we can just contain it while they're still staying there. Levels are high, so we're working on, and we believe we've already got the accommodation set up. We've been able to work through that pretty quickly. So we're just trying to get that finalized. We have another scope of work that has come in. So currently, right now, my lead inspector is reviewing that to make sure it's acceptable for it to go to the committee. And we're working pretty hard. Candace and EHB has submitted over about 3 or 4 applications that came over. One of them, unfortunately, was not able to move forward because there was no lead in the house at the current moment. So the source is coming from somewhere else. So that was relayed back to the health department, so they're working on that piece with the family. We have done roughly $4 million in our other repair programs between accessible homes for seniors, our traditional whole home critical repair program, our indoor plumbing program, our new calendar year 2022 program through the half whole home critical repairs grant program has seen 410 at the end of during this fiscal year deals for 41 or $4.1 million. That is just from July 1 to December 31st. So we're moving pretty quick. We are actually looking internally back within our executive management. We will, I think, by the end of the month, have enough applications to spend out the whole $10 million well prior to the calendar year of 2026. So we're looking to get additional funds there. We have another initiative in Baltimore City and Pine Street. It's called the Homeownership Work Program. That we're it's a pilot program that we've recently in the current budget asked for the same additional funding, but we're concentrating in Baltimore City in the Johnson Square project, and the other community is Cambridge and Pine Street. We're working closely with Habitat for Humanity and Chop Tank down in Cambridge, as well as Rebuild Metro in Johnson Square. We have a pipeline roughly of about 15 deals in Johnson Square. 3 have already been approved. 4 are currently in the process of getting final approval and get commitment. And then the other, if I could do the math there real quick, I think it's the other 8 deals that we have in the pipeline are waiting. We do have a scope of work. We are waiting on the customer to be able to get the contractor to come in and give a qualified bid. In Cambridge, in Pine Street area, we have a pipeline of 12 deals that are in the beginning stages, but they're a little bit more used to the process, the way it works with state. We have worked with them on other programs. So once we get our participation agreement finalized, we should have most of those deals in so that we can make sure that they're committed and done. One of those deals is actually being pulled out. It was a deal through Healthy Homes for Healthy Kids, so we're kind of reviewing on that. And I don't know, that's a lot of information. So I don't know if anybody has any questions. I know that we're sensitive, and I don't know if any other agencies would ultimately have any updates or feedback.
Any questions for Jack? All right, blazing through hot topics. MDE. I don't know if Tyler's on. Paula.
No, Paula's on. Tyler's not here. He's out of state travel. Paula, you have anything? You're muted. Paula?
Okay,
No.
we're gonna take that as a no.
Okay.
I think Cliff jumped off, right?
Yes.
All right, so we already heard from MDH. Paul, you got anything?
Paul, can you hear us? I don't think he can hear us.
Okay. Mangela, anything to report?
Got nothing to report. Thank you.
Awesome. Benita?
No, nothing to report.
Thank you. We already heard from Jack. How about
I'm
Cap?
sorry, guys. I apologize. My thing went missing. The only thing I want to inform commissioners of is that FDA has announced that it has draft guidance, and there's going to be a webinar on it on March 2nd, 2023 at 10 o'clock for the industry on action levels for lead and baby food. It's in response to the zero tolerance, I believe it's called, and the exposure to goal to reduce dietary exposure to contaminants while maintaining nutritious foods. I read over the guidance, and it's very specific to baby foods. So I'm curious to see, where else that that may go. I think this is the first step, and I think it's good, and they're welcoming recommendations and input. And the other thing that I wanted to convey to you is that the CDC has identified a cream that the Vietnamese population is using for eczema. According to the FDA, the threshold limit is 10 parts per million. This cream is over 7,000 parts per million. So there was an advisory that went out to locals about this cream. So I just wanted to put that out there.
Great. Any questions for Paula? Okay, where do we?
Sorry, Adam.
Go ahead, Barb.
I have a question for Paul. Have you heard anything about the spices from Costco? We've had 2 parents that reported that when they had spices tested, it was cumin, and the other one was ADU-BO, I think it was, that tested positive. And another parent that said, oh, I get my spices at a different store, but it's the same brand.
Well, that's very interesting because one of the things that I was hoping that the FDA guidance would come out on with this this guidance was spices mainly. If there are concerns, was there a consumer products safety announcement on that?
I wasn't able to find one.
Right. Can you do me a favor? Can you just send me those 2 items that you're concerned with? Because, there's a reason why we can't do, a lot of times we don't know the batch numbers because, a lot of people buy these in bulk. But if we know, if they're bought in bottles or we'll know the batch numbers, and then we can look at it that way. And I could work with Cliff's food services on that. The health officer has the ability to do recalls on stuff like that. But if we don't know about it, but I'd be happy to look into that for you.
Great, thank you.
Any other questions? All right, I didn't see anybody from, well, we already hit DHCD. How about Mary Beth, anything?
No, I don't.
Wes, anything?
Just give the time. We did want to really say appreciation to MD and MDH for this new and enhanced tool, looking at reporting on lead levels, really terrific work. And also thankful to Caitlin in the EJ office. This will really help looking at underserved communities and how we allocate resources to also overburdened communities. So thanks to all those that good work from GHHI.
Thank you. All right, any other comments or questions from the commissioners? Great. Any public comments? Oh, Paul, you're up. Can you hear us?
Yeah, just wanted to say briefly from the Maryland chapter of American Academy of Pediatrics, we just completed our 5th session, and that Cliff participated in, and he mentioned it earlier, and I'd like to just really publicly just thank him for participating. It really helped answer a lot of questions, and also helps reinforce the importance of agency interaction and working with the providers in our state.
Great, thanks. Any other public comments or updates? All right. Do I have a motion? Oh, wait a minute. All right, Mary Beth, we're going to call this meeting to close. Can I get a motion to close the meeting? Thank you, Paula. Is there a second? All in favor?
All in favor.
All right, everybody have a great month. If you have any questions, just reach out to Wendy and she'll get it. And by the way, you should be on the lookout for those bills, et cetera, et cetera. Have a great week, great day. See you guys.